A patient reports blood in the urine, another is struggling to empty the bladder, and someone else has been dealing with urinary urgency and incontinence for months. A patient's can significantly affect a patient's comfort, quality of life, and overall health. But before treatment decisions can be made, healthcare providers need answers.
Welcome to Healing Hands Nursing. Today, we'll explore 3 common urology procedures that nurses frequently encounter in both hospital and outpatient settings: cystoscopy, uroflowmetry, and urodynamic testing.
Urology is the medical specialty that focuses on disorders of the urinary tract and the male reproductive system.
This includes the kidneys, ureters, bladder, urethra, and prostate gland. Urologists commonly diagnose and treat conditions such as urinary tract infections, kidney stones, urinary retention, hematuria, urinary incontinence, and benign prostatic hyperplasia, also known as BPH. Now let's take a closer look at 3 important diagnostic procedures used in urology. Let's begin with cystoscopy.
A cystoscopy is a procedure that allows the provider to directly visualize the inside of the urethra and bladder using a thin instrument called a cystoscopy. This procedure may be performed to evaluate blood in the urine, recurrent urinary tract infections, bladder stones, urinary obstruction, bladder tumors, or persistent urinary symptoms without a clear cause. Because the provider can directly inspect the bladder lining, cystoscopy remains one of the most valuable diagnostic tools in urology. Before the procedure, nurses play an important role in patient preparation.
We review your history, check allergies and consent. We verify medications, including anticoagulants, confirm fasting, and provide education.
During the procedure, the patient is positioned comfortably, usually lying on their back. The area is cleansed using sterile technique. A local anesthetic gel is commonly applied to reduce discomfort. The provider then gently advances the cystoscope through the urethra and into the bladder. Sterile fluid may be instilled to improve visualization of the bladder wall. Depending on the reason for the procedure, the provider may inspect the bladder lining, collect specimens, obtain biopsies, or perform minor interventions. Most routine cystoscopies are relatively brief.
After a cystoscopy, mild burning, light blood in the urine, and frequent urination are usually temporary. Encourage fluids unless they're contraindicated. Teach patients to report fever, chills, inability to urinate, heavy bleeding, blood clots, or worsening
Next,
pain.
let's discuss uroflowmetry.
Uroflowmetry is a non-invasive test that measures how well urine flows from your bladder. The results help your provider evaluate how effectively you're emptying your bladder.
This test is commonly ordered for patients experiencing weak urinary stream, difficulty initiating urination, urinary retention, suspected obstruction, or symptoms associated with benign prostatic hyperplasia. The patient urinates into a specialized collection device connected to a computer.
Your uroflowmetry results show how well urine flows from your bladder. We evaluate the flow pattern, flow rate, and total volume to determine whether there's any obstruction or difficulty emptying the bladder.
After uroflowmetry, some patients may need a quick bladder scan. Most can resume normal activities immediately. Encourage hydration, follow up as instructed.
Urodynamic testing refers to a group of specialized studies used to evaluate how the bladder and urethra store and release urine. These studies provide valuable information about bladder capacity, bladder pressure, urinary flow, sphincter function, and urinary leakage. They are commonly used to evaluate urinary incontinence, overactive bladder, neurogenic bladder disorders, chronic urinary retention, and complex voiding dysfunction. In simple terms, urodynamic testing evaluates how well the bladder functions. Persistent urinary symptoms after testing should never be ignored because they may indicate infection or urinary retention. As nurses, our responsibilities extend far beyond preparing patients for testing. We help reduce anxiety, provide education, monitor for complications, and ensure patients understand what to expect before and after each procedure. These nursing interventions play an important role in both patient safety and patient experience. Thank you for joining us today. If you found this video helpful, please like, subscribe, and activate the notification bell so you don't miss future nursing education content. And let us know in the comments, which urology procedure would you like us to cover in greater detail next? Thank you for watching Healing Hands Nursing. We'll see you in the next video.